everyone, and welcome faculty, staff, students, family, friends, and the Downstate community. It is with great pleasure that I warmly welcome each and every one of you to our 2020 College of Nursing White Coat Ceremony. A special thank you to all of our students, especially Rebecca and Victoria, who have worked so hard to make this evening a success. A special thank you also goes out to Miss Pat Romaine, who also helped in the preparation of this evening's ceremony. This ceremony is an extraordinarily impactful and symbolic stepping stone in your lives. The white coat represents the virtues of altruism, responsibility, duty, honor, respect, and compassion. But there is so much more. As you put on your white coat this evening, there are 3 additional northern stars that I would like for you to assess, synthesize, and ultimately personalize for your success. These 3 P's are not physical assessment, pathology, and pharmacology. The 3 P's that I am referring to are passion, purpose, and possibility. Put passion into everything you do. Purpose. Allow the nursing profession to provide you with even a greater projected purpose. And possibility. Consider all possibilities, pathways, and pursuits along your journey. So students, are you ready to step forward and lead? Please realize and understand how very, very proud we are of all of you. Continue to study diligently and prepare with fervor. You are well on your way to a very rewarding career, needed now more than ever. Thank you.
Welcome students to the 2020 SUNY Downstate White Coat Ceremony. Well, here we are, at home. I know this wasn't the White Coat Ceremony we would have hoped for, and although you may be disappointed not having a formal ceremony, look at it this way. This year at Downstate is likely to be remembered as one of the more famous years in school history, and we're a part of that history. We will have a unique story to tell about the circumstances of our nursing school degrees. This is just one chapter, one small chapter, in our lives that will be filled with many more pandemics, personal and not so personal. It is how you respond to the circumstance that is more important, more defining, and more lasting than the circumstance itself. In figuring out that one corner of our houses that will have the best Wi-Fi connection, to locking ourselves in rooms away from pets, children, roommates, and our families, just to hear our professors cutting in and out, to talking for 5 minutes before realizing you were on mute, or having long, serious conversations with your dog before realizing you weren't on mute, and to virtually opening up our living rooms, home offices, and bedrooms to all of our classmates. When you look back on this very confusing and disorienting time, how you emerge from it will help define you. And as we continue our studies at Downstate, we will only build on these experiences to be the best nurses that we can be, on the ready for any outrageous event to come our way. And there will indeed be many of those to come. Now is the time, if ever there was one, for us to care selflessly about one another. This too shall pass, and the best is certainly yet to come. Find the joy, it's in there somewhere, and don't forget to wash your hands. Stay safe, and happy White Coat. Now we will hear from the American Association of Colleges for Nursing president.
We celebrate your White Coat ceremony. I'm pleased to introduce the Honorable Lauren Underwood to present the keynote address. Representative Underwood serves Illinois' 14th district as the newest nurse elected to Congress. She is the first woman, the first person of color, and the first millennial to represent her community. She is the youngest African-American woman to ever serve in the United States House of Representatives. Prior to her election, Congresswoman Underwood served as the senior advisor at the United States Department of Health and Human Services, working to help implement the Affordable Care Act, as well as prevent, prepare for, and respond to disasters, bioterror threats, and public health emergencies. Representative Underwood is also a former AACN intern who, as a graduate student at Johns Hopkins University, expressed a strong desire to serve in Congress someday. In less than 10 years, she has made that dream a reality. Representative Underwood is a strong, steadfast champion of nurses and the nation. She is a vibrant voice for compassion and humanism in healthcare, which is the heart of this ceremony and your work as future nurses. We are proud to have the Congresswoman join us for this momentous occasion and serve as an inspiration as you take your first steps to becoming a nurse. Congratulations, and please welcome Congresswoman Lauren Underwood.
Hi, everybody. I'm Lauren Underwood. I represent Illinois' 14th Congressional District, and I'm a proud nurse. Thank you for the honor of addressing you on the day of this critical milestone. I'm so glad to be able to celebrate with you. I'd like to thank the American Association of Colleges of Nursing and the Arnold P. Gold Foundation for coordinating this virtual ceremony and providing an opportunity for all of us to reflect on what brought you to this point in your professional formation. I completed my BSN at the University of Michigan, and it doesn't seem like that long ago that I completed my MSN MPH at the Johns Hopkins School of Nursing. I started at Hopkins at the age of 21, the youngest member of my class. I was ambitious, excited, and ready to chase after opportunities with an open heart and mind. I started my master's program in the summer of 2008, just months before the onset of the Great Recession. I was living a block away from my school in an unfamiliar low-income African-American community. The rapid economic downturn illuminated the poverty in the East Baltimore community I was living in and the inequality in our nation's healthcare system. The recession also accelerated the urgent sense of purpose I felt to pursue my work on health disparities. I quickly accepted a job as a research fellow at the National Institutes of Health Clinical Center, where I worked with nurse researchers to better understand clinical trial participation among minority patients in an effort to tackle that long-standing equity issue. I later worked as a research nurse on another health disparities study. And in my coursework, I focused on improving African American birth outcomes, examining infant mortality and preterm birth rates, and evaluating policy interventions like expanding Medicaid and funding nursing education. It was little more than a decade ago, in 2009, when I graduated from Hopkins. At the time, more than 40 million Americans lacked health insurance, and I saw a transformative opportunity in the Affordable Care Act to increase access to care and improve the health of the American people. I'm so grateful I had a chance to work on the Affordable Care Act implementation in the Obama administration after graduation. My commitment to ending disparities in maternal-child health outcomes continued in the administration, where I later worked to advance equity with the White House Council for Women and Girls. As I was serving out the last few days of the Obama administration, a classmate and good friend of mine from my MSN MPH program, Shalon Irving, gave birth to her beautiful daughter, Soleil. Just 3 weeks later, Shalon collapsed and passed away due to complications from high blood pressure related to her pregnancy. She was just 36 years old. Shalon was an epidemiologist at the Centers for Disease Control and Prevention, where she worked to investigate and eliminate health disparities. She was highly educated with a doctorate. She was excited to be a mom, and she had done everything right, and we still lost her. I couldn't believe it. Her death was a devastating reminder of the disparities that women of color face in our healthcare system. The statistics are unacceptable. Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women, and more than twice as likely than women of other races. Maternal health outcomes, which have been improving worldwide, have worsened over the course of my lifetime in America. Here, right here, in the United States of America, the richest country in the world. Looking back, I can see it was my training as a nurse and in public health that gave me the grounding and evidence-based decision-making that's not only essential to nursing, but to policymaking. That foundation and Shalon's story, which I carry with me every day in Congress, inspired me to co-found the Black Maternal Health Caucus to take on these disparities through evidence-based policies. It's why in March of 2020, I introduced bipartisan legislation to take urgent action to address our nation's maternal health crisis and to finally end the racial disparities in maternal outcomes. And I'm proud to say more than 100 members of Congress have joined me in this effort. Don't ever doubt that change is possible. My training as a nurse provided me with the data-based grounding that has been central to my work in Congress. But being a nurse is even bigger than the practical knowledge you learn and the skills you employ. Fundamentally, nursing is about the intimate moments that you'll have with your patients and their families at the bedside, answering their questions and addressing their fears in what might be the most difficult moments of their lives. That's what white coat ceremonies are all about. The traditions of compassion and patient-centered care that have deep roots in the nursing profession. I've carried this spirit of compassion with me during my time in Congress. In fact, some of the conversations I have with constituents aren't too different from the ones you'll have with your patients. People so often come to me when they don't know where else to turn. Whether it's an issue with getting their Social Security payments or challenges paying off their student loan debt, or an inability to afford insulin for their child with diabetes, in just a few short minutes, you can share in the struggles of members of your community and work to develop policies to help them. My hope for you as you begin your careers is that the spirit of compassion and service that drew you into nursing will stay with you and carry you through the hard days. And as our nation has seen through this pandemic, there will undoubtedly be hard days. But your passion for helping others, particularly the most vulnerable, is a light that will help you see in the dark. And when days are long and you feel tired or sad or worn out, remember that there are patients who look at you as their reason for hope. Also remember to take care of yourselves and look out for your fellow nurses on the front lines. When so many others depend on you, it's especially important that you're getting the support that you need. Because let's face it, our nation can't afford to lose you, not only for the clinical expertise that you'll display every day with patients, but in the wide range of ways that you'll be able to be change agents in your communities. Nurses are making a difference as clinicians, researchers, policy advocates, faculty members, and yes, even as members of Congress. Whether you'll be making breakthrough scientific discoveries or leading an advocacy campaign to push for access to affordable health care, your nursing background will prepare you for a career dedicated to promoting the health and well-being of your neighbors and our nation. You might be remembered by a mom as the person who saved her son's life, or a dad who watched his daughter's face light up every time you walked into her hospital room. You might be remembered by the elderly patient who doesn't receive visitors but knows you as a friend. You might be remembered for the important paper you published in an academic journal that advances our understanding of the impacts of air pollution on childhood asthma. Or you could be remembered for inspiring your colleagues to call their representatives and express support for legislation that will provide necessary funding for nursing schools. There are so many possibilities ahead of you, but one common thread runs through them all: the opportunity to make people's lives better. There's no higher calling. So, as you prepare to do this critically important work, I hope you're feeling inspired and excited. You might feel a little nervous too, especially in the midst of COVID-19. But as nurses are desperately needed on the front lines of this public health crisis, you will continue to be needed long after the pandemic. There are urgent challenges that must be confronted, from the disparities that exist throughout our healthcare system to the unacceptable barrier of costly, unaffordable care that hurts millions of Americans every year. There's a lot of work ahead, but for now, I hope you can celebrate this exciting milestone. Know that your families, friends, and classmates and faculty will be there for you every step of this journey. I'm so proud of you, and I can't wait to see you change the world. Congratulations, and remember to take good care of yourselves.
I'm Dr. McHugh, Director of the Accelerated Bachelor of Science in Nursing program. This is such a special time in the educational process of our nursing students when we formally invite you to put your white coats on, serve as a visual reminder of your commitment to practicing the highest level of patient-centered care. It is my distinct privilege and honor at this time to invite students from the following programs: RN to BS, Accelerated Bachelor of Science in Nursing, Family Nurse Practitioner, Women's Health Nurse Practitioner, Nurse Midwifery, and the Doctor of Nursing Practice. I invite you all to put your white coats on. Congratulations. We're so very proud of you.
My name is Dr. Barbara Kitchener, Director of the RN to BS program, and it's my distinct pleasure to present the following students to be virtually cloaked in this year's white coat ceremony. The students are Tia Thompson, Shamel Foote, Melchiza Felez, Marky Bagley, Londa Jackson, Kenya Eves, Federica Ford Belez, Anita Edwards, and Andre Cato. Thank you very much and best wishes to you all.
We congratulate and celebrate students from the Accelerated Bachelor of Science in Nursing program who are receiving their white coats. Keisha Aborji, Daniel Acasuso, Michaela Albertini, Ruben On, Kiva Appleton, Victoria Ivazian, Betty Babahanov, Yoni Baum, Stephen Berkowitz, Sephora Berman, Allison Beacom, Paul Bazo, Ashley Braithwaite, Latoya Campbell, Vanessa Carbajal, Maeve Carver, Keon Cheng, Nahima Damath, Kelly Donnelly, Eugene Adele, Dana Eldor, Cheryl Fink, Faggy Gantz, Ariana Gonzalez, Deborah Greenberg, Lekma Ali Prasad, Jamie Huan, Shemay Huan, Diana Ifreamova, Rebecca K., Lotrim Kelmendi, Insu Khalil, Christina King, Eliana Klein, Veronica Lake, Laura Lake, Emily Lamarca, Leandra Laundry, Tanya Lewis, Eric Lua, Daniel McCaffrey, Nicole McFarland, Mary Mitchell, Anthony Pang, Samuel Quiones, Rosie Ramirez, Ashley Reed, Joanne Rowland, Zachary Socosio, Marcus Santana, Rebecca Schaefer, Sabrina Shaw, Monica Sobier Shukahook, Amanda Stancheski, Maria Adelpha Tamayo, Sierra Troy Regier, Kristen Toomey, Anushka Ulysses, Haya Humaner, Brooke Velselberg, Samuel Venzenblatt, Coraima Velez, Anthony T.J. Valonis, Vicky Wang, Tracy Wong, Nicole Wu, Laura Woolley, Olivia Wayne. Congratulations.
Good day. My name is Dr. Beth Steinfeld. I am the program director for the Women's Healthcare and Nurse Midwifery programs. It gives me great honor to present to you today the names of the Women's Healthcare Nurse Practitioner students. They are as follows: Siobhan Bailey, Erica Barneca, Cassandra Bennett, Nicole Brown, Jenny Cardenas, Erin Cristiano, Sarit Cohen, Stacy Coles, Alexandra DeBas, Ebony Grant, April Hansen, Alicia Husbands, Samantha Erivolino, Diana Ilrizov, Shanique Ivory, Keisha Javelin, Natasha Joseph Johan, Megan Kay, Dina Klein, Sharon Lee, Ariane Millian, Graziella Orecchio, Marie Paris Wilson, Jennifer Radazu, Agnieszka Rampat Singh, Maria San Roman, Anya Sargent, Simone Suman, Suhi Thomas, Ajali Taibu, Tracy Ann Treadwell, and Elżbieta Tribala. Thank you. The names of the nurse midwifery students are as follows: Joy Noel Anderson, Susan Campos, Jacqueline Chen, Tracy Kwan, Akila Pascal, Alicia Richter.
Romana actor Leila Alidani, Cindy Alonso, Tiffany Alvarez, Irina Baraeva, Josephine S.C. Boutan, Amber Babka, Josephine Campbell, Olga Chipurko, Monica Christian, Osayuwa Cox, Alina Davidov, Fatoumata Diallo, Yvette Dolly, Jessica Dunk, John Duchmovic, Star Edie, Erna Excellent Valair, Natalie Ferguson, Andy Fu, Dika Gay Graham, Simone Hannah Clark, Billy Hector, Marina Hannity, Emily Huckman, Christopher Howard, Marie Claude Larache Gentil, Bianca Julian, Mireli Jumeir, Saif Khan, Non Ku, Diana Kirillova, Olga Kisilova, Lila Lagosh, Shanti Moharjan, Amulong Mansunov, Crystal Morero, Devika Matunkath, Shelley McLean, Diana Mensah, Sarah McLeay, Alana Mordukayev, Wendy Moretta, Jovita Moe, Kushbo Nakbal, Stephanie Nigman, Gabriela Rabinovitz, Kalita Raphael, Rebecca Rich, Esther St. Will, Paula Salazar, Kristen Sampson, Mark Schwartz, Jennifer Sidoti, Brandon Smith, Stephanie Soberanis, Ni Son, Rihad Taiha, Hyra Tanvir, Natalia Tan, Jill Thompson, Rada Vilnitz, Grace Wang, Carol Way, Miriam Weitzner, Alex Werner, Frida Rotslavsky, Amir Ziyamov, Maria Zorina.
you, Lauren Ellis, for participating in our white coat ceremony. Lauren is a DNP student, class of 2021.
Hello, I'm Dr. Mary Hickey, the Associate Dean of Academic Affairs. Please join me in reciting the nursing oath written by Florence Nightingale as you commit to providing compassionate care as nursing professionals.
I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully.
I will abstain from whatever is deleterious and mischievous, and will not take or knowingly administer any harmful drug.
I will do all in my power to maintain and elevate the standard of my profession.
And will hold in confidence all personal matters committed to my keeping, and all family affairs come into my knowledge in the practice of my calling.
With loyalty will I endeavor to aid the physician in their work and devote myself to the welfare of those committed to my care.
As we conclude this evening's ceremony, I will pass along to you the same advice I give to my own children, and that is, nothing truly worthwhile in life comes easy or without hard work. Whether you are beginning your career or advancing your career, remember that you received your education here at Downstate. Be proud of who you are and the ultimate gift you will receive for being a well-prepared and well-educated Downstate nurse. May the journey ahead be a joyous one for you. May it be productive and a healthy one for you. I wish you all very happy holidays. Thank you very much.